today to talk about the availability of COVID-19 vaccine for Duval County residents. As we can tell from the high volume of calls the appointment line received when it opened last week, people are very, very interested in getting this vaccine. And I'm glad to hear that and see that. I understand that residents had trouble getting through on the appointment line that the Department of Health set up for this purpose. Please know that I understand the frustration. But to get through this, I request that everyone remain patient and calm. Local health officials are aware of the issue and are working hard to find a solution as quickly as possible. There is now an online scheduling form that citizens can fill out for an appointment as well. But let's take a moment to look at where we were and where we are today. Back in March, when I declared a local state of emergency in response to this virus, there were so many unknowns about COVID-19. Now, less than a year later, we have a vaccine. That is a remarkable achievement. I'm grateful to the scientific and health community for working tirelessly and quickly to make this and other vaccines available to the public. I'm grateful for our leaders and public servants for getting plans in place to get this needed vaccine to our first responders, medical workers, and vulnerable populations. Though the development process was expedited to meet the needs of this global pandemic, these vaccines went through rigorous testing, studies, and trials to ensure their safety and effectiveness. If you have concerns, please discuss them with your doctor or a trusted medical professional. To assist the Department of Health in vaccinating as many of our neighbors as possible, the city has been working on a plan to provide additional vaccinations. But please understand that we, the city, do not control the vaccine supply chain. Your city has shown the capacity, however, to organize and operate multiple locations addressing COVID-19 concerns. For example, we secured one of the very first testing sites in the country by working with our state and federal partners. We brought our own city-sponsored testing sites online one day later. I'm hopeful we can announce more specific information about additional vaccination locations within the next day or two. It is also my intent to convert 2 of our existing COVID testing sites to vaccination locations as early as next week. This is a promising step forward toward the eradication of this virus, but we have many more steps to take. While we prioritize vaccinations for our first responders, frontline medical workers, and vulnerable populations, it is important we continue our safe practices to reduce the spread. I'm continuing to ask the people of Jacksonville to wear masks, practice social distancing, frequently sanitize hands and surfaces, and all the other precautions we've dutifully engaged in over the last year. Until most of our population get this vaccine, personal responsibility remains our most effective tool in fighting this virus. Now, as you know, the Florida Department of Health is the state agency tasked with administering the vaccine to Duval County residents. To talk more about their progress, patient eligibility, and improvements to the appointment process, I welcome Interim Health Officer for the Florida Department of Health in Duval County, Heather Huffman, to the podium.
Thank you, Mayor. I really appreciate your partnership in this along with JFRD. So I want to tell you a little bit of where we're at with the vaccinations. On December 23rd, late in the day, we were able to receive some of that portion of the 16,000 Moderna vaccines that we currently have in hand and that we've been vaccinating with. Last week and through today, we've also been receiving Pfizer vaccines, about 23,000. So if you add those together, that's 39,000 doses that we've received. This is in addition to what your hospitals have also received in order to vaccinate their staff, including their medical staff and any other staff that would have direct patient care. The process of these vaccines has come out faster than the statewide reservation system that is currently under development. So with that, we have had to go to an alternate Plan B, which led to us having the phones line as the appointments originally, which had some issues and challenges, and now we've been able to partner with the Emergency Management JFRD in the city of Jacksonville in order to implement that online appointment system. Again, appointments can still be made when we have additional vaccines at duval.floridahealth.gov. You'll see a link at the top in the yellow, bright yellow highlighted area for making those appointments. We will also put that information additionally out on our Twitter site so that as more vaccines come available, we will put those additional appointments out there. Again, this is appointments only because we must be certain that we have social distancing within the site that we're doing and that we have some kind of efficient manner in which we vaccinate these individuals. We will be getting additional allocations each week. We do not know that number. It comes out each week, and as we get those, we will open more available slots to the community. Currently, we are vaccinating between 850 and 900 individuals a day on appointments. We'll be running that for 3 weeks, and then on that 4th week is when the second dose will come in play for those individuals that have already gotten the first dose, and we will be able to ramp up to double that number, about 1,600 a day at this site. We are looking to open additional sites as we have more vaccine available. As you know, the more sites you open, the more administrative overhead you have as far as staffing, incident command, inventory control. The good thing is that our federal pharmacy partners are online to vaccinate our long-term care facilities. Those include your nursing homes and ALFs with CVS and Walgreens. Those are already happening currently. So all of those most vulnerable residents and the staff members that work with those most vulnerable are currently being vaccinated with the hopes of being the 2-dose series being completed sometime in February. And then lastly, I like to always end with the mitigation strategies that the mayor talked about. This isn't the time to let our guards down. This is the time to continue those mitigation strategies, which include mask wearing, hand washing, limiting the amount of distance we have with other people, especially those outside of our households, and not going to large gatherings of 10 or more. Mayor, I'll turn it back over to you.
And we are available for questions.
People that already made the appointment and they weren't able to speak on it because they didn't know, is there a hotline you can call to find out about the appointment?
So as again, we still have the same phone system we had last week, and so what we're asking individuals to do, if you cannot remember your time, do not just simply show up. We're only going to be able to see those that are at the appointment time in which they were scheduled. So what we'd ask you to do is try to schedule another appointment.
Several people who came out here today and they were told they weren't on the list, and Samantha was telling me that, you know, they filled out everything right, but it said that there weren't any appointments available. They submitted their form and there was a glitch in the system that still gave them a confirmation even though there were no appointments available. Those people, are they kind of just out of luck and they have to get back in the line there to...
So the system that we've been able to work with the city of Jacksonville is not a traditional appointment system. We're still waiting for that statewide system to come down. So the message that they get is, you know, your appointment has been scheduled. Unfortunately, if they never select an appointment time and date, which it says make sure you select only one appointment time and date, if they don't select a time at all because there was none available and they hit that submit button, they will get that message. However, we had 4,000 individuals that submitted invalid, incomplete forms. We did send out a robocall, text, and email to those individuals yesterday if they had the appropriate email, phone number in the system, so they all got messages that they had submitted an invalid, incomplete form and to not show up because they did not have an appointment.
So do they just start all over? They have to call and try to...
They'll have to call to get an actual appointment because they did not have an appointment.
Let's talk about the play out from here on out. We're mentioning we're doing 850 to 900. I know we said we want to do about 1,000 a day. What if we're also with 2 more locations from the DC3 and the Legend Center?
We haven't decided exactly what those locations would be. We're going to be looking at doing some redistribution of some formula to medical offices that are already signed up as COVID enrollment providers for the vaccine. We're allowed to do that by the federal guidance. So we're working on that this week to get out to those medical offices. Those are very important that those healthcare workers seeing primary care patients and urgent care patients are able to be vaccinated. So we're looking at that. And then we're going to be looking at pod locations that we can do if they're either at school locations or other locations that we would be able to do that social distancing.
39,000 doses, is that including the long-term care or do they have separate?
That is separate. So the long-term care facility is not part of our Duval County Health Department allotment.
Mr. Mayor, are you happy with how this rollout is going? There were a lot of, it didn't roll out very smoothly over the weekend.
Look, there's a lot of moving parts. I was on the phone over the holidays with Emergency Operations Center for the state of Florida as they worked with the departments of health all around the state. I've heard that there have been appointment issues throughout the state of Florida. We're here to help and be a partner in getting this vaccine distributed. These are untested times, uncharted territory. What we've demonstrated as a city throughout COVID-19 is the ability to organize places and move people efficiently in a safe way. We did it with testing sites, we did it with stimulus checks, and as the supply chain becomes more available and we're able to partner with the Department of Health, we're going to set up those first 2 sites, and there may be more, and we're going to do it efficiently. I think it's important that people understand that we understand their frustration. People are scared and want this vaccine, and we're going to do everything we can as partners to get it to the most vulnerable and then get it to the entire population. And look, when it's my time, where I fall on in terms of the scale, I'm going to take it. It's been offered to me at this point as an elected official. I'm healthy. I'm going to wait my time, but people need to know I'm not taking it right now because I'm concerned. The moment they tell me it's available to me based on my age and risk factor, I'm in. I don't know what's next.
Is there anything that people need to bring if they're on medications? Do they need some sort of doctor's note? Like if they're on a blood thinner, what do they need to bring with them?
That's a really good question. So first of all, bring your photo ID. That does help the process a little bit. The link to the consent form is on our website. If you can bring that already filled out, that expedites the process a little bit more. And then what we're asking for individuals to do is not per se get a doctor's note, but we're asking for patients to take patient responsibility. And if you have medical conditions that you're unsure if this vaccination would be appropriate for you or not, to talk with your primary care physicians individually before you make an appointment.
There was some social media conversations last night. How are you feeling about that?
You know, I would say if you look at the specific timeline of an elected official you may be referencing, for over 2 years now, that individual has personally attacked me and my family. The timeline speaks for itself. You can go see it. I mean, I am his timeline, as is my family, and I have resisted the urge to react. And I reacted as a husband and a father, and I'm moving on. You know, Twitter has the ability to be an amazing platform to communicate with people, give them information they need, even to be uplifting at times. But unfortunately, there's a lot of negativity in that space. And being attacked for years by that elected officials, my family specifically, I got involved in the negativity of it, and don't expect to see that again.
Mr. Mayor, I don't know if you read the City Council report. That investigation reveals that your office was part of the failed JEA sale. What's your reaction to that?
So what's interesting about that question is I learned that the report had been released to the media on the car ride over here. So you have an independent contractor hired by the City Council to produce a report that will talk about some of the people in my administration. And we not only have we not seen the report, I'm told we don't have access to it. So they want to get it to you guys so a narrative would start without our reaction. But here's what I'll say. I expect the report to make claims stated as facts that aren't based on facts, based on what we've seen over the last year, the way they've released their interviews. And I'm not going to react to that. You guys have had access to me throughout all of the discussions of any issue we faced in the city of Jacksonville, particularly this issue over the last couple of years, and I've answered those questions with great clarity. Take their report, do what you think is right with it. I'm moving on for the city of Jacksonville and making sure people get vaccinated.
So we did have a meeting this morning at 11 with the City of Jacksonville Emergency Management to look at the next week's platform. That should be available here shortly. We're looking at the second dose appointments for the individuals that are coming in now to be able to book those before they leave. So we're going to be getting that implemented again because we didn't have a reservation system. The day that we got this, we're kind of, having to play catch up a little bit, and I think we're doing a good job with that. We've got great partners here. The mayor has committed to making sure that partnership happens, and we're very thankful for that. as in with any new endeavor, it's bumpy at the first and it gets smoothed out as we move along, and I do foresee it smoothing out greatly.
And you take the first vaccine here, don't plan to have to come back here for your second.
As those other retail pharmacies come online, your CVS, Walgreens, Publix, Winn-Dixie, Costco, Walmart, all those items, places that you would normally get flu, a lot of those has signed up to already be COVID-19 vaccination providers. When those come up online and they have appointments available, the main thing is that an individual would need to make sure they get the same manufacturer for the same dose. So if you got Moderna as the first one, Moderna must be the second dose. If you got Pfizer as the first, you would need to get Pfizer as the second.
So your final message to people, we're giving out vaccines today for two groups.
Mayor Curry and other city officials there giving us an update on the number of vaccine doses available in Duval County and the vaccine locations in Jacksonville. The Prime Osborne Convention Center, we're there in front of right now, will be one of those testing sites, or rather vaccination sites now. He also said locations that were used for testing sites will be opening soon to give out vaccines. Right now, vaccines will be given by appointment only, as you heard him say, and many others. More slots will open after more doses are available. We also understand between 800 and 900 doses will be given out at first, but double that in a few weeks when the second dose is available.
So right now the city has had about 39,000 doses. Now officials also talked about a problem with the online scheduling site. Many people couldn't get through, they couldn't sign up. So now the city says it's worked out the kinks, working with JFRD, for example, in emergency management. 4,000 incomplete forms is what they say they've counted so far. They've sent out texts and emails telling those people not to come because they don't have appointments. Those folks were turned away if they did show up. And also the mayor again says at least 2 of the